Oh, you can't see my face. I think what to do. So I need to go up. My desk needs to come down. Hello.
One of the two.
One of the two will work.
Otherwise, we can just look at the knitting.
Well, yes. I know. That's a treat for you all. There we go. How's that? I'll sit forwards.
That's very good. Good evening. How are you, Jen?
I'm good. How are you, Olivia?
Very good. It's our first Instagram live together.
I know.
How exciting. Hi everybody. Thanks for joining. We'll just give everyone a couple of minutes to get online with us.
Hi, Marta.
So we are having, yes, an Instagram live this evening with Dr. Jen Unwin, and she will be introducing herself in just a moment. But just to introduce tonight's session and give people a little bit of background and context, this is one of a series of Instagram lives that we are doing previewing our upcoming Public Health Collaboration Conference. For anyone who's not familiar with the Public Health Collaboration, I'm a trustee for that charity. My name is Olivia Khwaja, and we are a charity based in the UK that is dedicated to helping people understand the importance of their own metabolic health and to have the right information and tools to feel empowered to take control of it and live a chronic disease-free life. So we are very much on that mission at the moment, and we are working on very many projects, but one of the key things that happens for us each year is an annual conference, which is now in 10 days time. Cannot believe it's that close. We're nearly into single figures. And we have quite the lineup this year, which we'll be talking about this evening. And we thought it would be nice to have a few conversations with some of the speakers that will be at the event and have a little bit of a sneak preview into what they'll be talking about, and to get some of their thoughts on what they're most looking forward to about the conference. So that's the kind of context for this evening. Hope everyone enjoys that kind of conversation. And if you do have any thoughts, obviously please comment, and if you have a question, if you could put it into the little speech bubble with a question mark in it, because that way we can see the question more separately to the rest of the chat, and pull that out and ask Jen whatever it is you may like to ask her as we go along. So that's a little bit about the setup, and I think to kind of kick us off this evening, it'd be great, Jen, if you could just, for anyone who possibly doesn't know who you are, just give us a little bit of background to yourself and your expertise and what you're up to these days.
Yeah, hi everybody. So my name's Jen Unwin. I'm a clinical psychologist by trade. I retired from the NHS a few years ago, and now I devote my time to the PHC and also researching and helping people with food addiction. That's my main obsession, and of course helping David, my husband, GP husband, Dr. David Unwin, in his practice with his type 2 diabetes patients and some other patients who come to our low carb group and are largely trying to improve their metabolic health for various reasons, not just type 2 diabetes now, to be honest. Yeah, so that keeps me busier than I was before. Now that I'm retired.
Yeah. Busier than you've ever been.
Absolutely.
So Jen, do you maybe some people kind of wondering, they'll probably follow you on Twitter, what are you up to these days? It looked like you were filming quite an interesting documentary last week. Is there much you can tell us about it?
Oh yes, I can tell you about that. Yeah, I mean, all sorts of things happen, don't they? But you know, it's just such a fascinating field. But yeah, so the documentary I was being filmed to be part of is a documentary about Dave Feldman's work. And if people haven't come across Dave, he's just and we must have him over next year. I think he would come. He's the most fascinating person. So he started a low carbohydrate diet, and sort of a few months in was excited to have his blood test done because he felt so amazing. He'd lost weight. He just, his low mood lifted, all kinds of things were better. And then he was kind of disappointed because he had a high cholesterol. And this is the thing that doesn't happen to everybody that adopts a sort of real food, low carbohydrate diet, keto diet, but does happen to some people.
Yeah.
That the cholesterol goes up or down. So it is the minority that happens to. And he's an engineer, and so he just got then fascinated by why that was, and wanted to understand it so that he knew that he wasn't going to be at risk of heart disease. And we heard him speak, I think it was 2017 at Low Carb Denver, and I was just blown away because he's just a citizen scientist in the true sense of the word. Yeah. He does experiments on himself, takes like millions of blood tests, and does weird things with his diet, especially to kind of see what happens. And he got really interested in those people who have this elevated cholesterol. Now you're one as well, aren't you?
Yeah.
So it's called lean mass hyperresponder sort of profile, and I wouldn't call myself lean mass really, but it doesn't. You don't have to actually be lean to be called. It's to do with having a very high total cholesterol, but you've got low triglycerides and low kind of bad cholesterol, but just very high good cholesterol. So they're filming a documentary about that, and my cholesterol, for those that are listening, was 19 on my last blood test. Which is incredibly high, and obviously my GP was kind of slightly losing his mind and trying to get me on statins and go to the familial I can never say that, cholesterolemia service. So I already had, you can have a scan of your heart which looks at whether you've got any calcification, which is the thing that you're going to worry about. Yeah, you know, sort of heart disease. So I'd had one done with Scott Murray, who's also spoken at the PHC before, preventative cardiologist up near here, and it was 0. So that was great. That's brilliant. Everything clear. But my cholesterol was 11 at the time, 5 years ago, and now it's 19. So I said to my GP, well, let me just have another CAT scan and see what's going on. So I did that, and Scott thinks I'm a bit of a strange creature as well. So because I've just had these scans, and because Scott and Dave were obviously aware of each other as well, we thought it'd be great to film there in Scott's clinic on the Wirral Way, where you can get one of these calcium scores if anybody else is worried about their cholesterol. Anyway, again, 0, completely clear. So all's good. No statins will be taken.
And is your GP a bit happier now, Jen?
Yeah, actually, he's fine. We know him obviously because obviously GPs tend to know each other, don't they, in the local area? So yeah, he's fine. He just thinks I'm very strange as well, because I largely do eat like you. It's mostly meat and fat that I kind of live on. I do sometimes eat vegetables if I go out or occasionally, but I'm mostly carnivore. And so anyway, you'll hear it in the documentary, the explanation of why they think there's these few of us, and why our cholesterol goes so high, and why it isn't for us harmful in the context of a sort of high fat diet, why it might not be problematic. And certainly I was so glad, I don't know about you, but to get that 0 score, because I was saying to Dave, I don't know what I'd do if it looked like my lifestyle was doing me harm in some way, because I feel so much better even than I did in my 30s and 40s. So I don't know what I'd want to change. You know, I'd be in such a dilemma about so many things. So it's great. Yeah. It's all good.
No, I don't think it'd be very easy for us to give up the steak at this point, would it?
Pretty difficult.
Pretty hard.
Yes, pretty hard.
I haven't actually had a CAC score, Jen, so that will be something I will need to do. But my my LDL wasn't as high as yours in any way, shape, or form. So you're definitely a new league, I think, of that.
Yeah.
But I think what's so important about days work is that we're going to finally at some point have some evidence to show that that isn't a harmful thing for many people if they're eating, the context of eating, a low carbohydrate diet. And that's such a misunderstood area of science still, even though we think that it has been understood.
Yeah. Yes, Scott said I had the highest that him and his colleagues had ever seen in the clinic.
Wow.
I'm taking that as a a
proud.
win. It's a win.
Flying the flag for the
flag for high
LDL.
cholesterol. Yeah.
Okay, so yeah, can't wait for that to come out. Do you know when that will be? Is there any idea?
I don't know, but they said they'd keep in touch. So, and obviously we'll post it on the PHC media when it's coming and coming out.
No, I didn't ask. We met Dave and his crew as well the night before you did.
Yeah.
So we picked his brain apart on all of this stuff, and we didn't quite catch when it was coming out. So we'll have to find out and look forward to that. So yeah, all very exciting stuff going on. But in 10 days' time, we're going to be all in Sheffield together, congregating and talking about metabolic health. I think we are just beyond ourselves with excitement. I don't know how we're going to contain it. So my question for you, Jen, is what are you going to be talking about? What kind of questions will you be addressing during your talk? Is there anything you can share at this stage?
So I'm actually on a panel. I'm not doing an individual session, as far as I know. Unless someone's forgotten to tell me.
Sorry, I forgot to tell you about that.
Yeah, and I need to start prepping the old PowerPoint, which I'd be happy to do. So I'm on a panel about food addiction. So obviously last year we had a big focus on addiction, which was fantastic. We had a separate day on food addiction, and then we had the keynotes, Paul Early and Bitten Johnson, who are sort of international names in the field. Well, they are really two of the biggest names in food addiction. They spoke at the conference, so it was great. It was great to get that focus going. This year we're taking a slightly different approach and having a panel discussion. So Heidi Yever's going to chair us. It's now, can I remember everybody that's on it? It's myself, I think Ali Ibrahim, Georgia, the fantastic Georgia Eid from America, and who's the other person?
Looking right now.
I'm embarrassed if she's listening. I should know. But so we'll be obviously taking people's questions on food addiction.
Oh, Claire Snowden, darling.
Claire, that's it. But we're also there's some things that we know we kind of want to discuss amongst us. I think it's nobody was speaking about this a few years ago. When I first started looking into it 5 or 6 years ago, it was really very niche. People weren't really talking about it, and now they are. I think people are accepting that this is a problem. And obviously in our space, what you get is people who totally believe that low carb, keto, real food diets is the way to go for health. They're convinced by the evidence of that, as I am and was. But sometimes it's a real struggle. There's a proportion of people who really struggle to stick with it, even though they know it's good for them and they feel better. Like we were both saying, we feel so much better doing it. Even then, there are people who struggle to stick with it. There's kind of no other explanation for that other than ultra-processed foods are addictive. so people struggle from time to time, and they're everywhere. I mean, the food environment's crazy. They're everywhere. It's not demonized enough, ultra-processed foods, so it's totally socially acceptable to go to events and there's nothing but ultra-processed food to eat. People putting it in front of you. We are bombarded with adverts for it. We go to buy petrol and there's this kind of gauntlet of chocolate and crisps before we can even get to the till. So it's really hard for people to change their behavior around this stuff, because it's, as I say, it's socially acceptable. It's everywhere. We've had it since we were children. It's not recognized as harmful in the same way as things like alcohol and nicotine are. Not yet. Not yet. We're
Not
working
yet.
on it.
It's coming.
Not yet. So it's great that, you know, that these debates are happening and there's more and more professionals getting interested. And the other thing that's super exciting is because under the umbrella of the PHC, myself, Heidi Yever, and Ellen Calto, who's also a trustee and a dietitian, we're working really hard to get. We're developing courses for professionals. So we're going to be having online courses for professionals so they can get educated about the topic of food addiction, so they can recognize it and they know what to do when they meet someone in the clinic, where to signpost them. Or further on, we're going to be doing more in-depth courses so they'll actually be able to sort of help people direct in the clinic if that's what they want to do. And we're also then going to be doing courses for the general public who think they may be struggling with food addiction. They can come and join either a sort of you know, a kind of DIY course where you just watch the videos in your own time, or some coach courses, and we're going to be doing online support groups as well. So all of those developments are super exciting. That's why I'm kind of busy and up at night partly as well, and as is Ellen and Heidi. And we're hoping to announce the first course for professionals at the conference. We'll be launching that. So we'll be all three there. We'll have a table so people can come and talk to us and register their interest. And I'll be bringing loads of copies of my book, Fork in the Road, all profits going to the PHC, and the journal, the 100-day journal, which we've got out as well, which is helping people to, you know, kind of journal and keep track and sort of try and change. Like we're saying, it's hard to change these habits.
Yeah.
But I think if you know, there's some stuff that we know about what can help people change their habits. So we've done a journal, and in the pipeline also a workbook for people with food addiction. So there's loads of exciting stuff coming, hosted by the PHC to do with food addiction. So whether that you feel that applies to you, or whether you work with patients you feel it might apply to, there'll be loads of stuff to learn. But you know, it's early days for the whole field, and Heidi and I and some other people internationally are also working on trying to pull together professionals and researchers to get some consensus around what it is we all do agree on, and what we think we know, and what maybe more we need to know in terms of this sort of this presentation, if you like, this sort of group of symptoms, and moving forwards to try and get food addiction recognised as an official disease, but problem, whatever you want to call it. So yeah.
And obviously you guys are progressing, taking this to the World Health Organization. Is that something that you can share with us, any updates on, or any progress? And how important do you think that is for the rest of it to come into play?
For me, I think it's kind of absolutely central that it gets some official recognition, because I think that's the way then that you get more funding for treatments for people. Because at the moment, what would you do if you had food addiction in the UK? Your GP doesn't know about it. Eating disorders services don't really get it on the whole. Mental health services don't understand it. Addiction services won't be offering treatment for food addiction, even though they understand that addiction model. So you're kind of falling between the gaps everywhere. So we need it recognized so that then there can be, I mean, research, but and research into these kind of treatment models. The treatment that we'll be offering online is the one that we wrote about in the paper that we published last year, which is looking really effective. We haven't published the follow-up data yet, but we're on to that soon. So just so that people are reassured, we haven't just sort of plucked ideas out of the air. We have based the courses that we're running are based on as the latest science that we know at the moment. Obviously it's going to develop like all of these things. So for me, that's why either the World Health Organization or the American Psychiatric Association in America, either of those two, if they were to recognize certain foods as certain these behaviors are around food as being a sort of food addiction, or more likely it's probably would be called something like ultra processed food addiction. There's a group in the States that are taking forwards the proposal to the DSM is the other acronym, and we've already put in one. We did put in one proposal for the World Health Organization, but it was not back, which we weren't surprised about. But they had to give us their reasons for doing that, and that was a great basis then, of course, for taking the work forward. And that's why we're doing this consensus work with all these international people, so we can sort of regroup and make another another attempt. Yeah, and we'll just keep going.
Well, it's gonna, however long it takes, we'll get there, won't we?
Exactly. I'm hopeful, actually. I am hopeful that in my lifetime, because walks like a duck and quacks like a duck. It's probably a duck. And it took a long time. It took 30 years, didn't it? Something like that for cigarettes. After people had started saying, this stuff's addictive and it's killing people. It took a long time, obviously, for industry to acknowledge that. There's lots of reasons. There's going to be a lot of pushback about the idea of ultra processed foods being addictive. It's all leaking out, isn't it? We've just had Chris Van Tulleken's great new book, and there's, as I say, I think the public is coming around to it, so that's great.
And I do think that you've got some other things going. So I think even if we don't have the official recognition, there's a lot of resources already on the PHC website and a whole section on food addiction. So even if it's not recognised by your GP at the moment, and it's something you think you may have, there's a little diagnostic tool that we have on there, which helps you assess whether or not you could have that kind of food addiction. I know when I went through it, it certainly made a lot of sense for me in my, prior to going low carb, that I probably would have had something of that sort. So there are resources out there that we are providing at the moment as well. Yeah, absolutely. And coming very soon, these courses. So if I'm not sure if it's quite up there yet, at the conference we've got a QR code that you can register. So if you want to be told, given updates of when the courses go live, then you can register your interest with us at the conference. I'm pretty sure it's going to be on the website any minute now as well. They'll just be, leave your email here if you want to be kept updated, and we'll get to you, whether you're a professional wanting to learn or a member of the public who would like to do the sort of the courses or the support groups. Then just sign up and we'll let you know when that's happening. Excellent. And you've also got a retreat coming up again, is that right? Do you want to say anything about that?
So this is great. We've done a few now. Heidi and I, and Ellen joined us the last one. We go for the weekend, so it's kind of Friday lunchtime to Sunday lunchtime. It's in the beautiful Lake District, in a lovely setting.
As a retreat should be.
And the food is fantastic, because we've kind of, we talk to the chefs and make sure it's all real food, low carb, and we go through the treatment program pretty rapidly, I have to say. It's pretty intense, but it's lovely because you're with a group of like-minded people, so you make great sort of link ups, and people keep in touch and support each other. And then we have these kind of ongoing on Zoom sort of supports afterwards. So it's a wonderful way to start if you think this might be an issue for you. So the next one's in November. I'm just looking at my calendar to see if I've written it on. No, I haven't. But it's November anyway, and it's on the PHC website, so you can look at the dates. And again, we don't make money out of it. If there is any profit left over when we've paid for all the food and the rooms and our expenses, Heidi and I don't take any money. And if there's any left over, that goes to the PHC as well. So you're also supporting the charity if you do come.
And how many are there on the retreat? Just so people have an idea.
I mean, we can cope with sort of 13 to 15, something like that. So there's not not massive numbers of places, but we try and do it twice a year.
Okay, well that's good, and that's on our website, so hopefully people will be interested in that. So sounds like there's lots coming up with food addiction, and it will all be covered at the conference. So I think that's given us a really great flavour for just the breadth of what you're doing as well. I don't know how you're managing to do it all, but can't wait to hear more about all of it. But my next question for you was just looking more broadly at the lineup and the agenda that we have. And I have to say, this year we are so excited about our lineup because there are so many topics that we haven't covered before. You know, cancer is not one that we've talked about. Alzheimer's is not one that we've talked about, and they're really significant, important metabolic illnesses that are so prevalent in society these days that we do want to really make that connection to metabolic health. But yes, there's lots of others on there, mental health. So yes, what are you looking forward to most, or at least your top three if you're finding it hard to choose about what we're going to have coming?
I'm so thrilled because obviously I was there at the first ever PHC conference in Birmingham, which was we had one little room, you know, in this kind of room. Andrew Scarborough was there. So
2016, wasn't it?
Yeah. Andrew Scarborough was there, and he's coming this year. So I'm so excited to see him again and to hear more about his story. And I mean, his story just blew me away at the time. So for those people that don't know, Andrew had a brain tumor, and you know that was pretty active at the time, I think in 2016. And I remember him telling me all the things he was trying to do to, you know, with his nutrition and fasting and all of these things. So it's been wonderful to follow his journey, and it'd be lovely to see him speak again. And super clever guy. So he kind of reminds me a bit of Dave Feldman, because he's somebody who's got that lived experience, if you like, and has then put their mighty brain power to try and help other people and to understand how what he's learned can help other people. And he's researching as well now. So he's going to be so interesting to listen to. So yeah, part of what I'm so thrilled about is that, you know, with yourself and all the new trustees that have come on board, the way that over the years, but definitely over the last 12 months, the PHC is just, you know, it's just going places now. And this conference is going to be proof of that. I think, you know, last year was amazing, but I think this year, you know, is going to be really incredible. So there's a lot of guys coming over from the States that I see occasionally and will really love to see. So I can listen all day to Ben Bickman. He's so clear. He's such a good educator, and again, so clever. I can't wait to hear him speak again. You know, I've heard him a few times, but I always learn something new. Yeah. So Ben will be amazing. We're so privileged to have him come over here and talk here in the UK. So if people haven't got their tickets yet, you know, it's worth it just to come and hear Ben speak, really. Georgia Eade, I just adore Georgia, and again, could listen to her speak all day. She thoroughly researches everything she talks about, and she presents it in such a comprehensible way, and it's so easy to sort of follow what she's saying. So really looking forward to hearing her. And of course Sean Baker, because he's just the sort of he's the father really of kind of carnivore diets and defending them. So it'd be wonderful to hear him. And the one person I've never heard is Dr. Anthony Chaffee. So I've watched his stuff on YouTube and, you know, seen some of his other stuff, but I've never heard him. I've never met him live. So so that'll be good. And I think what's nice this year as well is having the panels. I think that's a nice different way of presenting stuff rather than just kind of lecture after lecture. I think I'll break it up and involve the participants a bit more. So I think there's just loads to be excited about. I'll be exhausted afterwards. I've got a pre-event with Ollie Hart for GPs on the Thursday, and a post-event for patients on the Sunday. So it's all kind of elongated for me as well. And then I'm so happy to be hosting Georgia and Susie with us until nearly we're both involved in another event in June in Switzerland, so they're staying over in Europe, so that's a privilege as well, to be able to pick her brains for a few more days and show her a bit of the UK.
Oh yeah, no, that would be amazing to meet Georgia. There's so many people on the lineup that I think are all so excited about. I don't know how we're going to, like, I just can't, I've been thinking about it for so long now, and I can't believe it's actually going to happen. So let's just fingers crossed that the weather will be nice. I think that would just be the nice cherry on top, because it's a bit miserable at the moment. So we would be nice to have some sunshine as well, but either way, it's going to be
Although
so
when
good,
it's sunny and you're at a conference, you're a bit like, oh god, because you're inside listening to people.
Yeah, that's true.
I shan't mind too much if it's rainy on the outside. And it is Sheffield.
It is
all my
Sheffield.
ancestors come from Sheffield, so I know it quite well. And David, so his parents and my parents are all from Sheffield. So
yeah, so you've got the inside line. It's going to rain, is it?
Our forefathers. It does rain quite a lot there.
No, I'm just thinking about our American and international people coming over.
There is
so
that.
Just,
it would be nice
want
to
to show England off.
David's going to take Sean Baker and show in the Lake District after the conference.
Yes, that's true. So hopefully it will stay sunny if it can be sunny. So okay, so that is our lineup. It's going to be incredible. We're so excited. We can't wait for everyone to join us. And my other question for you, Jen, was just how, I mean, you touched on it already a little bit about, coming to PHC conferences and what they're like. Is there anything you can say about our conferences in general, about what is great about being there in person?
Well, I mean, the main thing is that you're going to get to meet all these people that you've seen online or you may have heard speak, but you can mix with them and talk to them, and everybody just chatting the whole time, and it's such a positive atmosphere. You'll never go to a conference that's more upbeat, because it's full of people who are feeling good, kind of healthy and energetic, and there's all of chatter, and food's usually amazing. So in terms of all the conferences I've been to in my life, the PHC conferences are definitely the most sort of upbeat and positive, and you come away kind of re-energized, wanting to kind of do even more to spread the good word. So I can highly recommend it if people are wavering. Definitely come in person. You won't regret it. Yeah.
And I've actually been to a couple of conferences in the last 6 months myself, and you just come away with such a buzz, and the networking is more than you would ever have thought. You think, oh, I would never have met those people otherwise, I would never have made those connections. And you're just inspired for weeks and weeks to come, and you just feel like you just want to kind of get on and make a difference. So
and you will learn loads. I mean, even those of us that have sort of been around a bit and heard some of these speakers, these are the people that are sort of at the edge, and they are presenting new stuff. I learned, like you're saying about cancer, I know I'm going to learn something from Andrew about that. You will learn new stuff, even
Sophia
if you
think
she's brilliant. Yes,
very good.
Yes, very good.
So there is nothing like being there in person, but this year, for the first time, we are also offering, if you cannot make it, and it is the best way to support us is to come to the conference, but if you can't make it, or if you're overseas and you're interested in all of these great topics on metabolic health, then you do have an option this year to join us online. And that's the first time we've offered that facility as well. So please look us up and have a look at the tickets, because they're available for online streaming for one or for both days. And so all our friends all over the world can be hopefully with us in spirit, and
that's a great
down a digital line.
Again, a great development that that people can watch, and you can watch live or you can watch afterwards. Perfect.
So 10 days time, and we're hoping to see lots of people online there, and all of you lovely speakers and all of our experts gathering there for what we think will be a fantastic couple of days, or 4 days for you, Jen. So I won't take any more of your time, but just want to say thanks for joining this evening. It's been great to chat and look ahead. And yeah, we'll see you in Sheffield next week.
See you very soon.
Thanks
Thanks,
everyone for
Olivia.
joining. Thanks. Bye bye.